Good afternoon. I'm David Sweat with Shelby County Health Department, and I wanted to give you an update on the numbers and some of the demographics and where we are with the epidemic today. As of this morning, we had 24,347 reported cases in Shelby County, and over the last 7 days, we've averaged 256 new reported cases per day. So that is good news for us compared to where we were back in July. It shows that the force of the epidemic is slowing and the number of new infections is declining for the first time in several weeks. We've had some good news over the past couple of weeks. And in terms of a breakdown on the data, we have some graphics and slides to show you this afternoon, starting with our distribution of cases by race and ethnicity. I don't know if I'm going to be able to see those graphics. So I don't know if you can see those graphics. All right, so all throughout the epidemic, we've seen a disproportionate burden that was borne by our Black and Latino residents here in Shelby County, and that continues to be true, although it has, in terms of the disparity, the amount of the magnitude of the disparity has somewhat lessened over time. It's still a true statement that 80% of the people who have been diagnosed with COVID-19 disease in Shelby County are either Black or Hispanic. When we look at our pediatric cases, we have seen also a disparity, a disproportionate share of burden on our children of minority populations. Prior to recent weeks, we had as many as 40% of our children with COVID-19 disease were Hispanic. We've seen that proportion has dropped. Now it's about 35%, but still it's a disproportionate share of the burden in pediatric cases being borne in those populations. What is good overall is that the percentage overall of cases that are pediatric remains relatively small. Now, if we can go to the next slide, please. When we look at our mortality experience, what we see is very different from our disease experience overall. 70% of our cases are younger than 55 years of age, and yet 87% of our deaths are in people above age 55. So that disparity has been noted before, and it remains a reminder of why it is so important for all of us in Shelby County, regardless of our age, to follow all the recommendations to slow and interfere with the spread of COVID-19. And that means hand washing, social distancing, use hand sanitizer if you don't have access to soap and water. It does mean wearing a mask whenever you're out in public, and also limiting the size of gatherings. And what we're trying to do is protect our older population, and in this instance, the older population begins at age 55 from having fatal experiences. And that's an important thing for people to do of all age groups throughout the county. And in terms of comorbidities, we continue to see the same comorbidities underlying the fatal cases as we've observed all along. Certainly diabetes, having obesity, having any respiratory problems such as asthma, COPD, any sort of damage to the lungs from any process, and then very specifically, any sort of cardiac condition. And that cardiac condition can be as mild as having high blood pressure. All of those are noted risk factors, and we see that almost 80% of the people who have died had some sort of underlying heart condition noted in their medical records. So once again, the reason we point this out is if you happen to have those comorbidities, if you happen to be diabetic, if you happen to be obese, if you happen to have a respiratory condition or a heart condition of any kind, that's especially important for you to take all the precautions that it's possible for you to take, and it's important for all the people around you to take as many precautions as they can to help protect you from coming in contact with this virus, and that will lessen our fatalities, which we are grateful our fatality rate stays low. It's about 1.3% of the diagnosed cases have been fatal. That is lower than the national average, but it is still a concern, and we need to do everything we can to protect our vulnerable populations regardless of what the vulnerability is.